The information provided on this podcast is for general informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your qualified health provider with any questions you may have. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast. Reliance on any information provided here is solely at your own risk.
Welcome. This is Birth, Baby. Your hosts are Ciarra Morgan and Samantha Kelly. Ciarra is a birth doula, hypnobirthing educator, and pediatric sleep consultant.
Samantha is a birth doula, childbirth educator, and lactation counselor. Join us as we guide you through your options for your pregnancy, birth, and postpartum journey. Thank you to our listeners for your continued support. If you enjoy our content, please be sure to like, follow, rate, and review wherever you listen to podcasts. This helps us gain visibility to other people that could benefit from listening in. Hey everyone, we are back with our resident midwife, Leonora of HomeBirthHoney here in Austin, Texas. And we are here today to talk about something that so many of our clients have, which is called prodromal labor. And it is kind of this mystic thing that people wonder about. And is this what I'm experiencing? So let's go ahead and get us started. First of all, thank you so much for coming back and talking with us.
Super pumped to be here as always.
This is a huge episode. Probably everyone who works with us and probably you as well is going to listen to this because it's so everybody always has questions about prodromal labor. Like, what is it? If I'm having Braxton Hicks, is that prodromal labor? So to start us off, can you tell us what is prodromal labor and how does it differ from Braxton Hicks or early labor?
Great question. When it comes to the stages of labor, you've got early labor, active labor, transition, pushing, third stage, etc. A lot of times people will think, okay, early labor contractions are somewhat spaced out, pretty tolerable, but I'm feeling it. That is accurate. When you are having uterine contractions and they are just coming maybe with some regularity, maybe a little bit spaced out, not really making it so that you can't eat, drink, go about your business, that can be prodromal labor. Prodromal labor is really going to be categorized retrospectively when nothing happens. Sometimes early labor just progresses beautifully into active labor. That's what we hope. That's the goal for sure. But we do like to manage people's expectations in that a lot of times contractions will start and then taper off and stop, or start and then just continue at a really, really paced out spacing. And your job as a birthing person is to figure out what to do. Now, if you are working with an OB, I hope you have a doula because basically when you're with an OB, if you come in early labor, sometimes they'll keep you and they will decide hey, you're 39 weeks and having contractions. Let's just go ahead and have a baby. Hopefully at that point you have a doula working with you that can give you some good advice and say, hey, let's go home instead. Or, if we are going to stay, let's not just jump right into Pitocin. But if you're working with a midwife, you're going to have somebody who you can be communicating with about this. You're going to have a team that you can immediately be texting or calling with and making a plan. That's kind of the beauty of midwifery here. And I'd say that's one way where unequivocally it's just going to be better for you, just to have that kind of personal touch.
We have so many people that ask us, is this prodromal labor? And I love that you said it's kind of a retrospective thing. It's now we're having a baby and we're like, man, those 5 days over the last 2 weeks, yep, those are prodromal labor.
Prodromal labor.
Now we know. But there isn't really a hard and fast way to know if what you're currently experiencing is going to taper off or is going to kick over. And I think that that's such a mind game for people. And so, yes, the communication with your birth team, like, you don't need your doula at that point. You don't need your midwife at that point, but in person. But the stuff from afar is where we kick in there and kind of help with managing expectations, encouraging rest, things like that. So is there a certain type of parent, whether it's first, second, third birth, whatever, is there someone that's more likely to experience prodromal labor than another?
Great question. You would think that it would be a first-time parent. You would think that they would be the ones that were kind of like, I don't know, is it? What's going on? But if we're looking at just like mass statistics, a first-time parent is probably, if they're starting to contract, going to continue to contract and just go ahead and eventually have their baby. When you are having your second, third, fourth, et cetera, you are going to need to emotionally prepare for your life, which is past 38 weeks. It's experiencing waves of contractions that get your attention and then go away. Typically, they happen at bedtime, or absolutely, like if you're tired or dehydrated at all. I have heard women describe weeks and weeks of quote unquote prodromal labor. But you'll notice before I mentioned, you should be able to eat, you should be able to drink. And this is one where I feel so strongly about this. You should be able to like take a melatonin or a Benadryl or a Tylenol PM, not all three of those things, and get some sleep. It's really hard to go to sleep when you're having contractions, even if they're 15, 20 minutes apart, because you are, 37, 38, 39 weeks, and there is a chance that you might have your baby, and your mind starts to play tricks on you. And unless you have just an absolute A+ meditation game going, and you're able to just get into that mindfulness space and really disconnect from your expectations, you are going to start having expectations. So as a midwife, my husband jokes about this. I'll take a call in the middle of the night and he'll whisper, take a Benadryl. And I know
like your buzzword.
Yeah, it's like, I know that there are some people for whom Benadryl is not the thing. Like, I know that there's that sort of like inverse reaction where some people, it makes them buzzy and awake. Most people, though, you take a Benadryl and it's like going into a coma. My labor, I will dedicate my home birth to Benadryl because.
What about Unisom? Same, similar?
Yeah, pretty much the same. Yeah. I went super late past my due date, did the whole biophysical profile, was getting membrane sweeps just about every day. Would just walk into the birth center, say, who's going to sweep me today? Finally,
you get to sweep me and you get to sweep me.
Anybody can, I don't care. But I really stand by membrane sweeps. I think they're very effective. But finally I got one at 41 and 4 and I felt a little crampy and I took myself on a solo date and got some spicy soup and swam laps and got an adjustment. And it was a lovely farewell to being a non parent person, just really just on my own. But I was really crampy. And I was like, okay. So I got home, took a bath, took a Benadryl, and the 5 hours of sleep that I got intermittently from midnight to 5 a.m. are dedicated to Benadryl. There is no way my nervous first-time parent ass would have ever slept through the night without that Benadryl. And I know that we are, as healthy, health conscious, holistic people, we are really conscientious about really avoiding over-the-counter drugs and just treating symptoms and becoming dependent on things. We really want to stay in touch with our bodies and stay super healthy that way. But there is a time and a place, and prodromal labor is that time and it is that place. I really think it helps.
We call it the psych. It's like your body is going, people will have a couple of hours of quote unquote labor and then it just goes away. And it's like this mind game. And then 2 days later, they're like, oh, this is it. And they have, a couple hours or a few hours of labor, or maybe even 8 hours of labor. And then it goes away. And I'm like, oh my gosh, what is going on here? And it's like your body's going, psych, every time. And it can be really, you might think, oh, well, that's not a big deal. Like, I got a little bit of practice. Maybe my body is doing a little bit of work in there. And then time goes on and great, I get to sleep between. I try to frame it for people sometimes as this is a gift. It's almost like you're doing little bits of labor, but then you're going to get to sleep for a while. And then you're going to do a little bit more labor. And then one day when it kicks in, your body's doing something. It's not for completely nothing. Maybe your cervix is thinning. Maybe your baby's getting into a perfect position. It's doing something.
Uterus is strengthening.
Yes, your uterus is strengthening.
That's essentially, like, biologically, that's why this is happening, is your uterus is a muscle and it's contracting and it's getting strong so that when it's time to push out a baby, it's got what it needs.
Yeah.
But it can really mess with expectations. And I have seen it not very often, but occasionally derail somebody because they could not get their head out of the game and, wouldn't take the advice to, take measures to get rest, and just got themselves to a point where they were really exhausted and dehydrated and just needed like actual therapeutic rest, at the hospital. And, that didn't preclude them from having a, beautiful vaginal delivery at the hospital. But, what we try to do as birth workers is, like I said, manage expectations so that if this is something that you're expecting, if this is something that you have a plan for, you are able to kind of wrap your head around it and not feel defeated if and when it happens.
Yeah, I think it's something that we try to talk about a lot with our clients, especially those who have had babies before, and especially those who are planning a VBAC, because I see it happening a lot with people who have had a previous cesarean delivery. And I think, I don't know if it's actually, happening more often to them or if it's just harder for them because there is such a mental piece in planning a VBAC. But that can be a real game changer when we're planning for it. Like, hey, this is your second baby. Prodromal labor is something that you might experience, and this is what it could look like, and this is what we can do to help with that. And I found that to be really, really helpful for people. And, like you said, just expectation setting. It's such a huge piece of it. I was one of the lucky people that got to experience prodromal labor for weeks before I had my second baby. And it would be every day around 3 or 4 p.m. I would start having my contractions, like, 6 to 8 minutes apart, sometimes 12 minutes apart. And they would just come and come and come all through dinner. And by 8 o'clock, I'd be so annoyed that I would go to bed, and then they'd, be gone by midnight. And that was my pattern for weeks. And for me, I think it actually worked in my benefit because when I actually went into labor, it didn't stop at midnight, but I was like, well, it's obviously going to stop. And so I just ignored it all night, and I would, have a wave and then go back to sleep and have a wave and go back to sleep. And so it was really, in hindsight, it was probably a benefit to me because I was able to sleep through that because I'd been experiencing it for so long. It was just kind of, my body's way of getting me ready for it. But man, it's emotionally rough.
It doesn't seem like you would be able to sleep in between contractions. Like intellectually, if you're thinking about it and you've never been pregnant or had a baby before, it seems like, how would I, have a contraction and then go to sleep and then like wake up 15 minutes later? That just doesn't make sense. But what you're not taking into account is the absolute and utter fatigue of the third trimester, the tired to your bone feeling at the end of the day, let alone if you're parenting children. The hormones that take over, the really strong hormones that peak at night, melatonin, oxytocin, all of these things that help our body to relax, even endorphins. And then, again, there are things that you can do, electrolytes, even just regular hydration with water, making sure that you're not getting malnourished. Sometimes people will think I'm doing fine because, they sipped on a smoothie all through the day and then had a light dinner. And I'm like, that's not adequate calories for, your body right now. Your body is needing more calories to not get to the point where your uterus is all irritated from, not having enough in it. So I am like a bit of a broken record as evidenced by my husband whispering Benadryl in the middle of the night. But I feel so strongly that these are things that are available to us that have, I always tell people, like, you're never going to take a Benadryl or a melatonin and then sleep through your labor, or like wake up with a baby head between your legs. You are never going to sleep through active labor.
That'd be cool though.
It would be amazing. I would be so happy. I would have all of my clients just nonstop popping, melatonin at night if that was the thing. But ultimately it's not that way. It's just a tool that you can use temporarily to help get the rest that is just gasoline in your tank before you leave on a trip. Like, it makes, even if you get 1 hour sleep before your labor starts, even 1 hour interrupted sleep before, it can be the difference of night and day between just powering through.
Yeah, I know you said before that, this prodromal labor happening, and we don't want to take medications and we don't want to do all of these things. But in this situation, why it's so important, I think what some people don't realize is this might not just be 1 or 2 days. This might be a lot of days. And then what happens is that we are just compounding the exhaustion. And so, maybe it's just like a little annoyance to your sleep, but after so many nights, and the biggest reason for a change in decision-making about pain management is usually not pain. It's usually exhaustion. And so if that's important to you, if you are having an out-of-hospital birth, or if you are planning an unmedicated in-hospital birth, and you really want that, that's very important to you, then you have to prioritize rest. And sometimes a tiny little intervention, like something like Benadryl or Unisom, can have a long-term, such a positive effect on not having these other interventions that you were wanting later. This is the clip that I want people to hear. It's like a small thing you can do to avoid a big thing. Because I think that we, like I said, especially with like social media and everything, we really get into this feeling of like, okay, like I'm taking all of these like really healthy supplements and I'm including all these healthy like herbs and eating locally and all these things that I can do for my health that are really beneficial, and not just like be popping, ibuprofen 24/7 when I get my period or whatever. Like we are trying to move away from that. But this little thing that you can do to help you with a big thing, because what you said about transporting to the hospital for pain relief, when I worked at the birth center, we would do interviews with potential clients, and they would ask us questions and we would ask them questions. And other than, tell me about transport, the number one question was, what about pain relief? What about pain? And the long and the short of it is that we did not transport for pain relief. I mean, I think there was maybe 1 or 2 births out of 1,000 that I can remember that really just, they were not feeling okay tolerating labor. It's just fatigue. It's really pernicious, is that fatigue. It really, sometimes you can help course correct with a little bit of IV fluid. Sometimes you can course correct with, some form of therapeutic rest. As midwives, we can give IV Benadryl, which actually, is a little bit more effective than taking it orally, but it's not the same as drugs, so. It's the fatigue is really the issue that can really slow things down and make it so that you need some real drugs. And your buzzword is Benadryl. Samantha, what's our buzzword? Have you done the
balances? Have you done the 3 balances?
Have you done the 3 balances? Like, you could find that in our text thread. If you just like did 3 balances, it'd be like 1,000 million.
Thousands and thousands and thousands.
And sometimes I think people get sick of hearing that, but sometimes this prodromal labor can be positional. Sometimes it's like your uterus is irritated and it's going, hey, baby, get in the right spot. Hey, baby, get in the right spot.
Absolutely. Yeah. Absolutely. Yes. There's a lot of contributing factors. If it's something to where that person is not able to rest at all, or really like they're kind of slowing down on eating, malposition is definitely something that we have on our radar. And, we can work with you doing some hip tilts and some rebozo work. We can hopefully get you hooked up with a chiropractor if you're not seeing a chiropractor. If you have an amazing experienced doula that can work with you, sometimes the doula will come over and help with those things. But yes, that can definitely kick things off unnecessarily.
Yeah, absolutely. Yeah, I think when we are talking to people who are experiencing that prodromal labor, it's always, okay, well, are you hydrated? Have you had electrolytes? Are you resting? If you've been up walking around, maybe it's time to sit down for a while and rest. Or if you've been sitting down for a while, maybe it's time to get up and move around. And then are you balanced? Have you been to the chiropractor, or are you doing those Spinning Babies 3 balances, which is our favorite thing in the whole world? And, if we've done all of those things and things are still going on, then, maybe this is going to be a prodromal that just needs some warm up, or maybe your body's getting ready to switch into that early labor pattern. And like you said earlier, we'll know when the baby's there, which one it was.
And that kills people. People can't handle that. It's so hard. It's such a mind game.
As somebody who loves to control everything and be a total micromanager, I will say not knowing when somebody's baby is going to be born, not knowing if their labor is necessarily progressing, that stuff kills me too. I want to be able to be like, yes, here's what's happening. But that is not the game that we're in, unfortunately.
It is not.
You know what else I tell people is kind of like the Benadryl thing you were talking about. And you're saying kind of it's helping prevent things later on down the line, bigger interventions. The word I use for some people is, hey, yes, we're doulas and we are all about like the most natural way, if at all possible and when possible. However, we also are like chess players where we can see, we've done this so many times that we can see 5 moves ahead what might be coming. And we know that if we move this pawn right here, it might make it so that somebody doesn't get our queen later. And I think that analogy kind of works for some people like, okay, well, my doula might suggest an intervention that surprises me because we all agreed that we're having a low intervention birth. But what I'm doing is trying to save the queen,
Love that. I think that's a perfect metaphor.
Yeah.
Oh, sure. I said analogy, you say metaphor. You're probably right. It is. It's a metaphor. I think it's a metaphor. I think you were right.
Yeah, no, that's a really, because we all want to, what do we do in chess? Save the queen. Is that how we play the game? I don't know.
Yeah. You don't want your queen to get got.
Yeah, you don't want your queen to get caught. For us, the queen being caught is like mom and baby being separated or a surgical birth. We are really trying to avoid those things, but we can see down the road and we can see, when I get off the phone with somebody who is having contractions that have not changed for a long time and they're kind of tired and irritated and they're just so ready to have the baby. And I'm like, hey, would you try a Benadryl, to say Benadryl again? And they're like, no, I don't do that. Okay. Would you get into the bath and have like 2 or 3 ounces of wine? Yeah, I guess. I don't know. We don't really have any wine at home. And I'm like, okay, do you have a beer at home? No, we don't have that. Okay. Do you ever take melatonin? And we kind of go down the line of all the things. And they're like, yeah, maybe I'll have a magnesium gummy. And I'm like, that's not the thing. That's great. Have some magnesium for sure. But when you're tired and dehydrated, your magnesium gummy, it ain't it. And then I'm like, okay, well, I'll talk to you in a few hours.
Yeah. When you're tired.
Yeah, when you're so tired, and once in a while I'm like, oh my God, they call me back and they're in rip roaring labor. Huzzah. That's wonderful. But more often than not, when you don't get that therapeutic rest, it's hard to get things back on track.
Yeah. It's so hard to, even for people that are not in prodromal labor, but are in like early labors for, first time moms who might have a longer early labor, trying to explain that, I know you're going to go into labor at night. You're going to be laboring when you're supposed to be sleeping, and you need to try to sleep as much as possible. So a Benadryl might be helpful at that point because you're going to be so excited that you want to, be awake and work through it and try to move things along faster. But really your body needs that warm up time. So it's going to be really important, really important to take those steps ahead of time.
For sure.
That's a lot.
Yeah. I also, you mentioned, well, this is our uterus's way of strengthening, So are there any specific things that have been said to be reasons for prodromal labor? Like, do we know that there are 3 reasons or whatever that people may experience?
So if we're going to differentiate between labor that kind of comes and goes and, we'll say it's not productive. We're going to put that in quotation marks because I do think that usually it is going to be serving a purpose one way or another. Like we said, a baby that's not in a great position, their head is deflexed or they've gotten a little bit posterior. Dehydration. A lot of women do not realize that they are chronically dehydrated. A great rule of thumb is half of your weight in ounces, and then add a little extra if you're drinking coffee, if you're exercising, if you live in Texas during the summer. So like if your weight is 160 pounds, 80 ounces would be your just baseline, like I'm not doing anything today. That's just what I get. Plus electrolytes. So malposition, dehydration, and then just that strengthening uterus, that's trying to get strong for labor. Those are going to be kind of the main things. Sometimes people, I think, are overly sensitive to the sensations. And I don't mean that they have a low pain threshold or anything like that, because that's really kind of one of my pet peeves when people talk about women having a low pain threshold, because we've kind of been, groomed our whole life to not pay attention to pain in our bodies. But giving too much weight, I would say, to the different things that we feel on our body. I get asked questions sometimes. They'll be like, okay, well, I ovulated and then I, had intercourse the next day. And then the day after that, I saw a drop of blood and then my left ear hurt. And then I had a twinge on my right shoulder. What does it mean? And I'm like, you have a body, you had sex, you're getting pregnant. Like, let's leave it at that. I can't dissect every single sensation in your body. And I think some of us are just raised to be a little bit more sensitive to these sensations in our body. And really, it could be a result of trauma. It could be a result of medical trauma. It could be a result of just like not feeling heard in your life. And this is a way that you can, kind of get people to pay attention to you, is to talk about your body. But it's a bit of a fine line, because we want you to pay attention to your body. We want you to be aware of what sensations you're feeling and to be able to kind of mentally catalog that. But we don't want you to be giving weight to every single sensation that you have in late pregnancy. And oh my goodness, when there is a 7.5 pound fetus inside of you, plus placenta, plus amniotic fluid, plus all of your organs have been squished to the side and all over. And your uterus is anchored to your sacrum by these crazy ligaments. There are so many sensations that you feel in your body all day long, all night long, so many things. And some of them we can work with. Some of it we're like, okay, like let's get a belt around your sacrum to help hold your hips together. Or let's get some pelvic floor physical therapy, or let's start moving our body more, or swim some laps or whatever. But some of it is just that you have a body and you have another body, and those two bodies are together, and it's just a whole lot to feel.
Yeah. And I tell people in hypnobirthing class all the time, like, ignore it until you can't, because the more attention you give it and the more weight it holds in you, the more mental load that takes. And that's exhausting. So, people will be like, well, I'm just going to watch TV, or I'm just going to do whatever. Cool. Well, if you could be in a room in quiet, that would be better. Well, why? I'm not really tired. Well, because all of the external information coming into your brain as well is still tiring. That's still some sort of tax on your system. And the more you can rest, the better. And I know, again, for first-time parents, this is so hard, y'all. That was me. Like, water's released at 3:15 a.m., made myself a peanut butter and jelly and ran to the hospital. I wasn't even feeling anything yet. And then with my son, it's 5:30 in the morning, and I'm like, there's 2 more hours left on this alarm clock. I am ignoring that. I timed him. Every time I woke up, I pushed that little button and I go right back to sleep. And that's when you are better at sleeping. But oftentimes, our first-time moms get this huge adrenaline rush the moment, and it's normal. But you have to be able to talk yourself through it, because one, it could be just some practice waves, just some little prodromal labor, little bits of your body trying to figure stuff out, and just don't get so disappointed about it. Kind of take it as a gift that it may or may not be time right now, but I get to kind of experience what this feels like. I can practice my breathing techniques. I can practice some relaxation techniques here or put on a meditation. And then if it stays, cool. If not, well, guess what? Buckle up. That's what parenthood is like, is about a little bit of a mind game all the time. So it's just practice for that too.
Absolutely. It's so hard to ignore something that you have been hoping and praying and imagining for, months, if not years. It is a huge mind game. But I do find that our clients that have a mindfulness practice, our clients that have a relationship with a doula, our clients who have seen friends around them in labor, it's really comforting and helpful for them to be able to kind of pull back and not have their head get caught up in this expectation game, and to be able to just sleep if sleep is possible, rest if rest is possible, and just, like you said, ignore it until you can't ignore it anymore.
Absolutely. So to sum us all up here today, for anyone who needs the kind of a recap, our top tips for dealing with prodromal labor is, I guess, one, that it can happen to anyone and there's not a whole lot we can do to prevent it. 2, rest as much as possible with the help of some therapies if we need it, with the permission of your provider. Chat with your provider before you take anything always. We want to make sure nobody's, going out and taking anything just based on what we're saying in this podcast. So chat with your family, chat with your provider. But rest as much as possible, prioritize that, ignore it as long as possible. If you can, not give it that attention, that really is such a huge piece of this. And I think that's where a lot of, like what you were saying, the mindfulness practice and the mind work that we do in childbirth education and in all of these different things really comes into play, is in that lead up phase. And then of course we'll be using it in more active labor as well. Hydrate
and nourish
and balance.
Hydrate, nourish, and balance.
I want to add one other thing.
Yes.
Some forms of intimacy can be really helpful. If you're kind of just teetering and it's like, is it, isn't it? And, if you feel like being intimate and your waters have not released, that can be great. If that doesn't feel like a great option for you, kissing, physical contact is great. If you don't have kids, love on your pets. Like really, we release oxytocin when we are loving on those around us. So, if you've got a baby at home, that can be really helpful to be nursing or snuggling. But if you don't, you can just love on your pets. And that really, really helps your body to know that, it's like the opposite of cortisol. I'm safe, I'm happy, I'm relaxed, I'm in my zone. And then if it's going to happen, it might happen.
I love that. And I know in the future, we're going to have a whole conversation about labor promoters and due dates and all of that. And I think we can definitely chat more about some of those things that can help kick over prodromal or that kind of slow lead up into labor, because there's a lot of things that can help for sure. So stay tuned for that. Be on the lookout for that when we have Leo back for, I don't know, your 10th episode with us at this point. You're just here.
Reporting for duty.
I love it.
Thank you so much for being here again.
Stoked to talk to you all. I hope you have a good rest of your day.
You too. Bye.
Thank you for joining us on Birth, baby. Thanks again to Longing for Orpheus for our music. You can look him up on Spotify. Remember to leave a review, share, and follow wherever you get your podcasts. See you next week.